I realize that many Americans have grown nervous about reform. So tonight I want to address some of the key controversies that are still out there. Some of people's concerns have grown out of bogus claims spread by those whose only agenda is to kill reform at any cost. The best example is the claim made not just by radio and cable talk show hosts, but by prominent politicians that we plan to set up panels of bureaucrats with the power to kill off senior citizens. Now, such a charge would be laughable if it weren't so cynical and irresponsible. It is a lie, plain and simple.
I think we have to have rules that say that we are going to provide good quality care. And end-of-life care is one of the most difficult sets of decisions that we're going to have to make. And end-of-life care is one of the most difficult sets of decisions that we're going to have to make. We don't always make those decisions explicitly. We often make those decisions by just letting people run out of money or making the deductibles so high or the out-of-pocket expenses so onerous that they just can't afford the care.
Standards, including, quote, I will apply measures for the benefit of the sick according to my ability and judgment. I will keep them from harm and injustice. My next guest, a physician for almost 30 years, says health care reform in and of itself violates the Hippocratic Oath. Every doctor takes the Hippocratic Oath, often on the first day of medical school. This is a rite of passage where a new physician swears to moral, ethical, and professional standards, including, quote, I will apply measures for the benefit of the sick according to my ability and judgment. I will keep them from harm and injustice. My next guest, a physician for almost 30 years, says health care reform in and of itself violates the Hippocratic Oath. But that's not all. He says reform gives government total control over your life. Here's Dr. David Janda. He's an orthopedic surgeon and the author of The Awakening of a Surgeon, one doctor's journey to fight the system and empower your community. Dr. Janda, what is the worst aspect of health care reform that you have seen in any of the proposals in the House of Representatives or the Senate with respect to the regulation of the behavior of a physician?
Well, Judge, I believe all of us in the front line of health care delivery believe that we do need some type of reform. There's no doubt about that. However, when you boil the President's plan down, Speaker Pelosi's plan down, Senator Reid's plan down, what they all focus on, the heart and the soul of all of those plans, is to deny care and ration care. And I can tell you, as a provider, as you mentioned, for almost 30 years on the front line of health care delivery, I can tell you the most unethical and inhumane way of cutting health care costs is to ration and deny care.
All right, how is it that any of these programs, we don't know which one is going to pass or even what the final language will be, but we know what the thrust of each of them is. How is it that they will force folks like you and the hundreds of thousands of other physicians around the country to violate the oath that you took, the Hippocratic Oath, to attend to the sick and do them no harm, Dr. Janda?
Yeah, to deny and ration care is doing harm to patients, Judge. And it's interesting because we all tend to think of this health care plan as currently being discussed in Congress, which it is, but it's really two parts. This is the second part that's been proposed by Senator Reid and Speaker Pelosi and President Obama. But, Judge, what I believe 99.9% of folks don't realize is the first part of the health care plan is already in place. In fact, that first part was part of the stimulus bill. It was hidden in the stimulus bill. And in fact, the lead rationing board has already been passed into law The president has already appointed all 15 members,
wait a minute.
and it's been funded
you used a
for
word that's
$1.1 billion,
you used a
Judge.
a phrase that's giving me agita. You know what agita is, heartburn. What do you mean rationing board? We already have rationing boards and we don't know about it? Who's rationing what?
Well, in the stimulus bill, an organization was created called the Federal Coordinating Council for Competitive Effectiveness Research. That's a rationing board, and it's already in place, and it's already been appointed. And in fact, in the current bill proposed by Speaker Pelosi, they have now awarded that council an entire center.
All right, give me an example of rationing. You're an orthopedic surgeon. I come to you with problems with my knee. There are other people in your office with other problems with bones and joints. What would the federal government tell you that you would call rationing with respect to me and the other patients that you would be attending to?
The judge, what will happen is that, and what was going to happen is that the government is going to set up protocols, and they'll say, Janda, you have this patient, their diagnosis code is 123. You have to take care of the patient in the following manner. You have to go to number A first, then B, then C. That's what you have to do. Now, if you don't do that, there will be penalties, there will be fines.
All right, that's my next question. So what
ends up happening...
How does the government know what you are doing with your patient? Don't we have something called the patient-physician privilege? Isn't the relationship between a patient and a physician in medicine and in law about as private and sacrosanct a relationship as there is? Is the government going to get in between the two?
Yes, I believe they will. And I'll tell you why, Judge. Because also in the stimulus bill, there was an organization created called the National Coordinator of Health Information Technology. And that coordinator is to review what's happening through doctors' offices and through hospitals and how patients are going to be treated. They'll have the electronic medical records readily available for them to review. And in fact, in the stimulus bill, a direct quote, it says that this coordinator will, quote, guide medical decisions at the time and place of care. You know, Judge, there was a recent Investor's Business Daily poll that said that 45% of physicians would leave the profession if this plan went into place.
All right, wait a minute.
Judge,
the government is going to ensure...
It would break my heart, but I'd be one of them.
The government's going to insure 30 million more people, and we're going to lose 45% of our physicians. That'll force rationing in and of itself.
Absolutely. And even if you look at the figures that are being battered out through the Congressional Budget Office, you know, the way they're going to pay for this plan, they say, members of Congress, is that they're going to cut $500 billion out of Medicare, or $426 billion, depending on who you believe, but over 10 years. But in 10 years, we're going to have 30% more people on Medicare.
Dr. David Janda, thanks for joining us.